Hello, Dr. Sandesh Mayekar.
Hi.
Can you give me a little introduction? I know your name does not need any introduction, but it will be very helpful for the audience to know that who you are.
Well, I'm a dentist practicing for the last 42 years, graduated in 1980 in oral pathology, did research on oral cancer, then went into general practice because money was coming from a low background, low economical background with father not there. Started my practice in 1982. Then 1986 I got bored of doing the same thing, so I did introduce aesthetic and cosmetic dentistry in 1988, and then went with aesthetic cosmetic practice. Introduced an academy in 91 as a founder president, so today they call me father of aesthetic dentistry. Started teaching the whole country about that. Became a consultant for Miss India, Femina Miss India in 93 onwards till today, last so many years. Promoted dentistry a lot. Then in 2004 I realized that there's something called TMJ, so I did my masters in TMJ orofacial pain from Tufts University when I was 51, graduated in 54. Introduced that subject in India, nobody knew by that time. And then 2016, as I was conducting IICD conference, aesthetic conference, so I introduced DDS, Digital Dentistry Society of India, so digital dentistry. So 2018 I got a title from International Association for Dental Research and Indian Society for Dental Research as father of modern dentistry. And my family is, well, 2 daughters, 1 wife. So one of the daughters is a dentist, second one is in public health from Colombia. So small family, both are married, enjoyed.
That's great, doctor. That's very commendable. So now you are a faculty of advanced program in leadership and business excellence in dentistry. So in the dentistry field, you have worked for so long and you have done so much. So why do you feel this program is something that will actually benefit dentists?
Well, actually I am also alumni of ISB. I did my accelerated management program in 2018 to understand the business part of. I got interested in so-called marketing dentistry in 1994-95 when I got introduced to Dr. Mrs. Rama Bijapurkar. She is IIM Ahmedabad faculty and great market guru. So she was just talking to me and I was telling her about what I do. So she said, what you are doing in dentistry is called marketing. Then I got a book called Philip and Kotler. Then I read that book and I really said, that's called marketing. I can give a single example that 1982 when I started my practice, usually when you open your practice, you do the opening of your practice is usually timing. What timing do you think people have?
10 a.m.
10 a.m. to?
10 a.m. to 7, 8 p.m.
Yeah. So, but most of them have 10 to 2 or 1 to something on an auspicious day. What I did was on Sunday, not auspicious day I did puja. And Sunday I kept it open from morning 9 o'clock till last, somebody came at 10:20. The idea was to get everybody to the clinic, so that's called marketing, to introduce my, so that I did it without understanding that it was called marketing.
Correct.
I did my dental camps in my society where I stay in Hindu Colony, Dadar, Mumbai, during Ganpati festival, free dental checkup. Who is doing? And I used to call interns and PGs from dental college. So who is doing? Dr. Mayekar, who is going to become a dentist. That means I introduced myself as a future dentist in that colony. Right. So that was called marketing according to Rama. So I realized that my experience is in marketing. So I started giving first lecture in marketing in 1996, 97. So then I interested, so most of my lectures is practice management, marketing, etc. And I educate on dentistry. So I feel that dentists should ask one question to their self, why patients should come to me. And then they will realize the importance of marketing, letting patient know who you are, what you do. I felt this course should be there because today the marketing, people feel that marketing is only social media, go on Instagram, show your cases. So there's nothing different between everybody can put the cases. My daughter can put the cases, you can put the cases, I can put the cases, there's no difference between them. Difference comes when the patients, you do the soft skill, how you talk to the patient and all. So this type of program where non-dental faculty gives you the framework and dental faculty like us can just filling the gaps or do the filling of the framework, I think dentists will know exactly to do profession and business combination is called professional business.
Right. So, doctor, what do you think is one of the things which is lacking in today's dentistry industry, or is a very big problem?
People lacking in dentistry, the very big problem is that dentist mindset is only to earn money.
Right.
And patient's mindset is that I want warranty and guarantee. So both the ways they are wrong. Now patient take their teeth for granted, the free teeth what they get, they take it for granted, God-given teeth. But when they come to dentist, what we do, they want that for lifelong. Now they have to understand that it's artificial. So that's from patient side they should understand. From dentist side, what they should do is see the benefit of the opposite person, that's the patient.
Right.
He will take care of you. The more conservative you are in giving them maximum results, the more faith in the dentist and the trust in the dentist will come. And they will get more patients, and overall health of the human being, the patients will change, because all the problems start from gut. The teeth are very important, which patients don't give importance to that. They feel I've got 32 teeth, even if 2-3 went, so what? So I tell them you got 10 fingers, 1 finger goes, so what? So that's not, God has given you teeth, they should be there with you till you go. And to maintain that teeth, you have to service with the dentist. Like any car, from bicycle to car to Rolls Royce, everything, even plane requires servicing. Similarly, your mouth needs a servicing. That's from the patient point. Dentist point of view, there is an ocean of patients in this. Every human being has to go to a dentist. Imagine there are 1.4 billion people in this country. Everybody has to go to dentist. So if everybody has to go to dentist, you got so much of population. So why to generate work? Be conservative, and I think patient will be very happy. In fact, somebody asked me a question. I think some radio jockey asked me a question when he was interviewing. You say be preventive. You're the only doctor who says that do preventive. How do you earn money? I told him that automobile industry doesn't earn in selling the car, they earn in servicing the car. So there's less investment, less pain, less recurrence problems, etc. So I feel both has to balance, patients as well as dentists. And dentists should know that don't take peer pressure. They should not look into left and right that this guy is charging this much. You have to have your own confidence. You do your own costing, and you have to value yourself and value patient. And both of them should value the time, which is money.
That's great, doctor. So what I hear from you is that clinical skills is just not enough to do dentistry, correct? So like how you focused on marketing and other aspects. So what I want to understand is that how much significance does a clinical skills take place in a normal practice for a dentist?
See, clinical skills you have to know. You know, when you do practice, there are 3 things which are very important. It's called showmanship. That means your clinic, everything has to be good. Salesmanship, the soft skills. How do you speak to patient? How do you understand the patient? How do you diagnose the treatment? Explain the treatment plan? All these things is called soft skills. And then comes hard skills, that you actually work. So work is very important, but the sequence is the same. And workmanship can give other patient, but first is soft skills. Now soft skills is varied from doctor to doctor. Why? Because the community coming to you are different.
Right.
The soft skill is how to make the patient understand what is dentistry and how you are doing, what are the problems, how they can prevent the problem. So soft skill, it has been shown, the study has been done, that wherein the success of a dentist, 85% is from soft skill, 15% is from hard skill. What you learn and what I learn is the same, but hard skills. But the soft skill, the way you will explain to our cameraman and I explain to our cameraman will be different. And that is breaking and making that he will come to me or go to you.
Correct, absolutely. So lastly, Doc, that's a very insightful. Just wanted to just wanted a few words that you can share to our dentists who are watching this, that one thing that they can do differently or one thing that they can implement today that will make a change in their dentistry.
Well, I again repeating the same thing. What will change in dentistry is diagnosing properly, planning properly, and for that you have to understand the patient properly. Secondly, once the enamel is gone forever, once the tooth is gone forever, so please be conservative to save. Don't grind the teeth unnecessary. Don't extract the teeth unnecessary. Patients have got no knowledge. They come from reading Google or this and that. They will tell you remove and do implant, and then there is a dilemma in your mind. Oh, I'm going to earn so much money. But only one thing I can tell you: every patient is next to God. Never cheat them. And the moment you do something purposely, that means you are cheating the God. Think every patient is your family member. Or will you do in your mouth this? Will you do in the mother's mouth? Yes, do it. No, don't do it. If you do that, I think it's not roti kapda makan, but you will get basic heavy luxuries in life, which is not necessary, but you will get it provided you are ethical and think that patients are next to God.